Welcome, everyone. My name is Dominic Chiarenza. On behalf of Kintaro Cell Spa, I'd like to thank everybody for joining today. Today's webinar, Wonders of Stem Cells. This webinar will be presented by Dr. Ihor Miliaiev, Regional Deputy Director of Medicine here at Kintaro Cell Spa. So based in Vietnam since 1996. He spent more than 15 years working in alternative holistic medicine, and he successfully treated over 100 patients using Kintaro Cell Spa. So just a little housekeeping before we get started. So if you have any questions during the presentation, just type them into the Q&A box in your Zoom control panel right there on the right, and they'll be answered during the presentation. And then we'll have some time at the end for a brief discussion. We'll be able to answer some of those questions. Okay, I think without further ado, let's hand it over to Dr. Ihor.
Thank you very much for Dominic. Good evening, your part of the world. Good morning from Vietnam, where, as it mentioned, I spent the last 15 and probably now coming to 23 years of my life doing a research of combination East meeting West, just like we do it at Kintaro Cell Spa. Okay, guys, just making sure you can see that.
Yep.
Yes, okay. A few words about me, as Dominic already mentioned. I find my sort of mission and purpose in combining the best medicine, bringing the best to our clients and patients in Kintaro Cell Spa. And in my research, I found that combination, and that what we say the stem cells. I'm gonna jump straight to the case to explain why we do that. Let's say there is a patient and he's 63 years old and he has ischemic heart disease, and upon that he got cardiac sclerosis and had to undergo the bypass surgery, and of course there is stable angina pectoris, and there are more that behind the screen we are having a person in his 60s probably having difficulties breathing, working up the stairs, simply not enjoying the everyday life. Modern medicine would pump you up with lots of drugs, of course, after all their surgeries are done, and put you on what I call the life support rather than health care. But with Kintaro cells, what do we see? Increase in myocardial perfusion of left ventricle of heart after single course of combined therapy. And 6 months later, you can see the results are still there. So we're talking about one combined treatment. 6 months later, the blood circulation in the heart is still good at that age. So that means a person can get back on his feet, walking on the park, playing chess, going out at picnic, enjoying normal quality life. Why is that? Because people, when they grow older, unfortunately, as some doctors say, the aging is a disease. If there is a disease, can we treat it? I'm sure you may know one of these guys. This one would look familiar. On the previous slide, this is Mel Gibson's father at his 100th birthday. Looking pretty good. Some people even say looking better than Mel Gibson now. How did that happen? Well, 10 years ago, he had those conditions that I mentioned earlier. He had the heart deficiency, he had the kidney deficiency, and he had to go for the right hip transplant. But of course, when you are 90 and you have weak health, no doctor would accept you on his operating table, no matter how much money you pay. This is the time where money cannot actually buy health and normal life. Well, his son took him for stem cell treatment, and 10 years later, this year, Hutton Gibson, I believe, celebrating 103rd birthday. Is he the only one? No, we have people who went and now praising the stem cell treatment, as for example, Mike Tyson, who used to be the youngest world boxing champion. Why is that? Because let's say Mike Tyson is coming to those 60s, probably he's thinking ahead of his own time and age. What I will be like at 60s, as a heart condition right now, the killer of number one in the world. So another 60-year-old patient And another good results, and more importantly, you can see 1.5 years later, the blood circulation in his heart is totally in good condition, much better when he had ischemic heart disease. Some people don't really want to go openly about that. So what some people, as Rick Perry did not reveal when he had undergone a surgery, that it was injection of, let's say, his own stem cells. We at Kintaro Cell Spa, we don't do autologous or your own stem cells, let's say, because number one, following simple logic. If you want to go for anti-aging, and you're using something of your age, how much anti-aging can that be? Does that make sense? I do believe it does. And the young guys, the younger you start, the longer you will be lasting. Like Cristiano Ronaldo, Rafael Nadal, and as already mentioned, Mike Tyson. If we are thinking those only for sports injuries, fast recovery. That's not really true. Actress Selma Blair undergone stem cell treatment for multiple sclerosis. The disease that was damned by most of the doctors is uncurable. We will see how it goes on her, but I do believe that she might have a very good and tremendous recovery, as our patients in Kintaro Cell Spa do. So if somebody's thinking, oh, this is something new, latest technology, well, I'll have to disappoint you. As you see, the term, the actual term stem cells was first proposed by Alexander Maximov in that time's King's Russia. And then the experiment started as a beginning of so-called Cold War, and then continued until now, where we have the FDA approves first clinical trials for COVID treatment. United Emirates, the Sheikh, is sponsoring the treatment for COVID by stem cell himself. China has concluded, I believe, around 100 treatments, successfully concluded around 100 treatments of COVID by stem cells. We in Kintaro Cell Spa have come up to just over 2,000 satisfied patients worldwide. As our presence right now, we are counting, I think, around 30 countries around the globe. So just another example of ulcerative colitis, something that you have to suffer as long as actually you are undergoing the traditional conservative medical treatment. Why I know that? One of my cousins had it before and was suffering for years, switching from one pills to other pills, and basically had no improvement, had to be made redundant, jobless, and then, you know, more problems start when you cannot support your family as they expected you. But judge for yourself. Before and after, and only 32 years old, the man has got his column back into the normal, healthy conditions. If you ask me, well, how many diseases, I would come with a big number of, sometimes, again, what medical science do, incurable diseases. We can talk about stroke, we can talk about liver cirrhosis, we can talk about vitiligo, we can talk about even brain stem infection. But going to more details, cardiovascular diseases are #1 killer in the world. The more years you count, the more problems you can have to your heart, to your blood circulations. With the current health or other disease care, you will probably not be able to enjoy all the benefits of life and even your own retirement if you have that one. How much enjoyment can there be once your health is not in a good condition? But as you see, before the therapy, the 73-year-old patient almost had no blood circulation. But even 2 years later, how can I say, he's got the new heart or he's got as good as old? Definitely his heart had improved, number one. Number two, it lasted already for 2 years. So why aging has become a problem? Because according to American research, the age at which a person can be completely healthy is 44. This year I'm 33. That's for women. And 44 men. God, I'm already not healthy, with the average expectancy of 72.6 years. In other words, going through your 30s, every average person suffers from a physical infirmity with so-called fading life. Why is that? Because when you are coming to a 90-year-old man is 500 times lower the healthy condition than a young one, and the probability of dying at 90 is 50%. Who runs that aging? Who does all those tricks? Just want to introduce one personal case. This is one of my patients that I attended about 5 years ago. She was 76, bed-driven, and of course, the hopes were, how can I say, not really high, because we were just introducing and starting in Vietnam. This is how she looked when she had undergone the first treatment. But as you see from a medical report, after the second treatment, and that what I have witnessed with my own eyes, she started walking. To the first treatment, she was carried by one of her grandchildren. After the second treatment, I saw her walking with a cane. She was not bedridden anymore. She had undergone 3 treatments, and we had a recovery of about 65% of her condition. So at Kintaro Cell Spa, where we are talking about a totally new outlook on health treatment, not the traditional approach when it's sort of hard for you to reach that zone of health, but actually now here is where you can choose which way to go. You are talking to the agents who connect you to the company who providing you a most efficient, most natural, and most importantly, the least time consuming treatment, getting you overall health return, disease eliminated, and most importantly, prevented. We are thinking about your future. So personal, and we are doing that on a systematic level. We have a patient at 62, multiple system deficiency, because he's got diabetes type 2. He's got, as you can see by his creatinine level, a kidney deficiency. He's got high blood pressure. He's got gastritis. He is constantly on 11 pills daily. 11 pills. As an Indian proverb said, if food is not your medicine, then medicine becomes your food. And he totally proved that to me, swallowing all those pills throughout the day. So before the treatment, his creatinine level was 361. Just after one treatment, it went down to 299, improving his kidney condition. Let's say from 15 to 19 liters after one treatment. His glycosylized hemoglobin also went down. That shows a very fast improvement in diabetic treatment, because usually that takes 3 months, and we were able to do that, as you can see by the dates, in 1 month and 1 week. We have improvement in his heart condition, because the proBNP substance is being increased once your heart is being expanded and dilated. As you can see, from 361 in just 1 month, we were able to drop that down to 231. That means that heart is going back to the normal condition and working much more effectively. And as I mentioned about the time consuming, as you know, especially the Western philosophy goes, time is money. So we are asking about minimum of your time, because you don't have to check yourself into the hospital for even 1 day. The treatment as simple as any other infusion, where you're lying down on a sofa and had to undergo maybe sleep, as most our patients do, 1 hour. When we do the slow drip with Kintaro cells, about 40 to 60 drops per minute. In 1 hour, the procedure is finished. You can have 8 hours, 12 hours, up to a day for rest. Then 1 to 3 weeks, your body start to change and enjoy the 3 most important effects. The pathotrophic effect, that's when the cells are identifying the damaged, weak, sick areas in your body, those that need regenerated. By homing effect, they are going there, making it their home. And number 3, producing around 100 substances treating your body. So we're talking about, number 1, least time consuming, non-invasive, no surgery required, no ethical problem, and especially no immunological conflict there, as time saving. And what are you getting by that? I'm gonna skip the slide because I think I'm going too much into the heart problems, but you know, they are number 1 killer in the world. But actually this slide that can show you very well what I mentioned before. Once your heart is being dilated, expanded, and you see it, some doctors call it the bull heart, that's when those broad BNP numbers are starting to climb up. So in this guy, he's 37 years old, as some doctors say, right now the diseases are getting younger, means they're hitting the young generation. So in over just 8 months, he's got his heart going back to a totally normal condition. A long time, 8 months, compared to what he had undergone if he went for traditional non-stem cell, non-Kintaro treatment. More medical reports that I'm gonna bother you with maybe a little bit later. But how do we know what's happening in your body once you are lying down that hour and you are enjoying that slow drip, or maybe just simply drip? 10 minutes after the drip, the cells, they mark green. With blood flow, start to be redistributed throughout your body. 2 hours later, as you can see, with the blood flow, they are almost everywhere. Big amount go into the brain. They can enter through the hematopoietic barrier, not like, let's say, most medicine are being stopped there. That's where we have the tremendous recovery, let's say, from the stroke, as my first patient. You see a lot of them are gathered around the lungs. So that's why, let's say, as I mentioned before, China has a tremendous result in treating the coronavirus with stem cells, as most of the patients being sick with pneumonia. A lot of the stem cells are gathered in the hip and pubic area, and that's where we have a good side effect stimulating your sexuality. And that's where we advise patients to undergo a couple treatment. Once the husband does a treatment and wife does not do that, she will be very happy, but definitely tired. So in Kintaro Cell Spa, we advise them to have a family packaging. Where the blood flow, that's where the cells go. But one more important thing I just gonna pay attention to. You see on the left arm, there's a poke, and still 2 hours later, we have the green around that hole. What does it mean? That means on a cell-to-cell level, they do identify, there is a simple damage. To your conscious mind, that's where the needle enters the body, but to the cell, they only identify, okay, this needs to be treated and regenerated. That's why 2 hours later, they are still there, making sure they're fixing that vessel that was poked by a needle. And now, at the age of, let's say, 30, as some patients, the results show, you think, I'm 30, I'm actually already healthy. But if you're looking at actually her blood work, then you think, oh my God, your hemoglobin Not really good. Then you have your cholesterol low. Then, oh, you even have problem with your kidneys. So after one treatment and a month later, we have a kidney recovery, we have a lowering of hemoglobin, we have normalization of protein, we have the 30-year-old being normal, healthy 30-year-old patient. Most importantly, if we are talking about diabetes type 2, it's not the diabetes that actually is going to kill you, but what diabetes does to your brain, to your heart, to your retina, and especially to your vessels, the micro vessels, let's say, in your food. Usually, the patient who has no circulation in the food, they would have to undergo the amputation. Imagining a 30-year-old guy without one food, actually being invalid for the rest of his life. Speaking of quality of that life. But even with local injection of Kintaro cells, we were able to restore the blood circulation. And let's say, not that he can only walk, dance, play football, but enjoy the normal life. My personal pride is not actually only about regeneration, but about the quality of life. At 95, when my grandma had 40 years of high blood pressure and joint problems and heart deficiency, for the last 5 years of her life, did she regenerate much? I can't say. Only to the point where she was still able to use a 1974 Zinger machine sewing my underwear without glasses. How is that possible? Oh my God, I tell you how. I started doing the Kintaro cells treatment for her at her 90s because when she was 98, due to her weak heart condition and high blood pressure, she came very close to stroke. Very close. She was rushed to hospital where my cousin worked and luckily was saved. She was not paralyzed, but then she developed fear of leaving the house because she thought, you know, I'd rather die at home than somewhere on the road when nobody can save me. So one treatment per year, and the results were very simple. She was enjoying life, she was in bright mind, and most importantly, she was not on any medication. So that's why in my research, and that's why I choose stem cells, as I mentioned before, as the most naturopathic way of treatment, because in our body we have two processes. It's regeneration and degeneration. Once we have enough stem cells, regeneration exceeds, but with age the stem cell count is going down. Where can you get the source? We do provide the source at Kintaro Cell Spa. So most importantly, it becomes not even treatment of the disease or anti-aging, but as Thomas Edison said about 100 years ago, that the future there will be doctors who will interest patients in the care of human frame, cause, and most importantly, prevention of the disease. So my approach, where I combine the East as treating the holistic experience and coming up to the treatment of the human being, not a simple organ or the disease, but most importantly in prevention, because prevention, I do believe, the most is the best, much more effective, cost-wise, time-wise, medicine. That's what I do at Kintaro Cell Spa. Thank you very much, Dominic. I turn it over to you.
Yes, Dr. Ihor, thank you very much. Thank you. And I guess we'll go ahead and take some questions for now. Just a quick reminder for everybody in here, just make sure to type your questions in the Q&A box in your control panel there. All right, we got a couple here. I'll take this one. John. So John here was diagnosed with diabetes type 2 3 years ago. And it looks like he's still having trouble regulating his blood sugar. He's 5'10" and weighs 275 pounds. Both of his parents are diabetic. And so he wonders, what is the potential for stem cells to treat diabetes type 2 in his condition?
Okay, that is a very interesting question. Thank you very much. And I really appreciate that when people do provide enough information so we can provide more precise decision and a draft, for example, of treatment. Because with the stem cells, with Kintaro cells, each person must be evaluated. This is basically what Hippocrates was doing a long time ago, suggesting that even people with the same disease must be treated differently according to that time he called what now we might say their character. But the stem cells, as I mentioned before, they have the ability to identify where the problem is, number one. Number two, they can go to the point of the disease, fixing the problem. Right now, it's good that you mentioned that both of the parents are diabetic, and the latest research shows that there are only actually 5% of really genetic disorders that we are experiencing. But with stem cells, as it's shown, they can go to your pancreas to fix the problem, but sometimes the problem is not there. Not that they can only fix the problem in pancreas, but as I mentioned before, once you are once you've been suffering from diabetes for years, the stem cells will be redistributed through your body, fixing the problems that were caused by the diabetes, most importantly, preventing the problems and let's say maybe killing them at the root that and stop them from spreading throughout the body. Though I do have to warn you, the higher your age, the more years you had suffered from the disease, the more treatment you will probably have require even by stem cell treatment, because the Kintaro cells will not only attend your pancreas, but will attend your whole body, rebalancing your system. We are talking about getting your new quality of life.
Great. Okay. Okay, here we have a question from Michelle. She is a 67-year-old mom still recovering from a stroke, which she suffered in 2019. And she wants to know, can stem cells be used to treat stroke?
Okay, that is a very interesting question. And as I mentioned before, one example is my first patient who was 76 and had been paralyzed 20 years after the stroke, developing conditions such as diabetes, etc. So there is always a question, 20 years after the stroke, how can a person regain the activity of the brain? And for example, in this video, we also have a patient who of 47 years who did have a stroke and was wheelchair ridden for 8 months, fed through the tube, having difficult conditions that actually can be seen if you take a closer look into her eyes, how they are sometimes not really focused. This is where she's arriving. So when the stem cells, as I mentioned before, with the blood flow, they can enter the hemopoietic barrier of the brain, which means later when they pass that through, they go to the brain and improving the conditions. And here is actually, as probably everyone knows, we have 14, 15 billions of neurons. We have a huge reserve. So there's the question in stroke recovery is re-stimulating, reigniting those neurons and giving them the new connections. That's what recovery of the stroke is. With patients like this, for example, in Vietnam, providing the physiotherapy, using the alternative medicines such as acupressure, acupuncture, herbal treatment, I can get them, let's say, up and walking, not running, first walking, but that would take me probably 2-3 longer years, mentioning that the patient has to practice every day. What Kintaro cells can do, even after the first treatment, as the patient experienced, as she was through the treatment halfway, she started noticing, oh, my sensitivity in my hand has come back. After the treatment, she could stand, she could walk on her own. First time in 8 months. That, someone would say miracle. I would say, well, it's actually the pure science. She is at that term of her life at 47, where she still, as medicine, as a science, say, relatively healthy. She could enjoy her first pizza, though not much success in swallowing. But how long it's gonna last and what are the overall results? She's walking by herself. She's talking by herself. So that is actually a huge burden off her mother, her family shoulders. So it's actually like I would have to say that, not really in scientific way, not much matter how much you spend, how many years you've been paralyzed, because the brain does have all the necessary reserve that can get you up on your feet and, let's say, walking or eating or even taking care of yourself. You want to do the faster track? Go with Kintaro cells, because they may provide it the fastest, the most natural way.
Great.
And yes, she is walking, she is playing. And she must be so disappointed. And I was like, God, guys, I only started walking with this COVID and restrictions.
Thank you for that. Okay, we'll go through, I think we have time, I guess, for one more.
All right.
Take this one here. So the question from Ellen. She is 69 years old. She had a heart attack in 2018, so 2 years ago. And for years, she had angina pectoris, tachycardia, shortness of breath, swelling, all the common things for people that suffer from heart failure, according to her. So how can stem cell therapy improve her current condition, or her current situation, rather?
Oh, thank you. That is a very interesting question. As we mentioned before, and up till now, the cardiovascular diseases are being the killer #1 in the world. Let's say once you had undergone Kintaro stem cell treatment, heart is the first organ on the way that stem cells are going to enter. And once there are some signs of weakness, of heart deficiency, the stem cells are going to identify that, and they're gonna make it, let's say, some part of stem cells are gonna stay in the heart, fixing those conditions, regenerating the heart tissue, as the stem cells do have the ability to turn into cardiomyocytes. And I believe some scientists recently, I think it was Israel, who succeeded in growing the actual heart from the stem cells. So once the stem cells enter your body, they gonna face the heart, they gonna make it their home and regenerate the conditions. And in my personal practice, I had even patients who had undergone the bypass surgery already, being on heart medication. After stem cell treatment, they had to learn the Russian saying goes, I can't remember where my heart is. which means once you actually have the heart condition, it does cause you pain. And this is where you know, okay, my heart is here on the left. Once the stem cells regenerate your heart tissue, you sort of forget where the heart is. So those patients who were in their 60s were not able, let's say, to spend a lot of time in the gym on a treadmill, or they wanted to climb the mountain with bypass surgery after the stem cell treatment, were able to do that. And especially living, let's say, in a sometimes too hot summer condition, such as Malaysia or Vietnam. As I mentioned before in this presentation, 3 cases of heart disease were recovered, number 1, rapidly, number 2, had long-lasting up to 2 years results after Kintaro cells treatment.
My name is Harvey. I'm 81, and I'm from the United States originally. Well, I had irregular heartbeat. I had a minor stroke back in 2012. And that's when I decided to retire. The valve in my heart is good now. It repaired it, apparently, because last time I was to see the doctor, he said, I may take these pills away because it seems to be beating pretty well. And they did a scan of my heart, and they found that the valve is no longer any problem. The after test was a few weeks ago, and he was quite surprised. And he said, your aortic valve is nothing to worry about. It's fine. And that was good news. I felt mentally much more energetic. I still am. I was getting pretty tired a lot of times, taking naps, and I don't take nearly as many naps now as I used to. And for the first time in a long time, my legs really felt good. I do more walking now. We go on lots of walks. I go further than I had for a long time. My activities have improved in many areas. In my writing, I write short stories, and my saxophone playing, and so forth, is full of energy. But I really relaxed when they gave me the stem cells. I guess we slept then till morning, and I woke up and I felt great. I could balance better. I could do a lot of things better in just one day, perfectly safe. I can only say that you'll feel better once you've done it.
No, I was going to sum up and say that basically we need to add maybe one more slide to the history of stem cells, starting with Alexander Maximov inventing the actual coming up with the word stem cell, because he did not invent that. It's Professor Haeckel was using it in 1884, I believe, the stem cell in German that they use it. But we are coming to, as everyone says, the new world, maybe not order, but definitely new world condition where people may be starting being more aware of their own health in terms of coronavirus pandemic, but most importantly is the prevention of that, how to get ready, because everyone is probably being feared now by the second wave of treatment. What to do? What is the most natural way to enhance your immune system? What is the most natural way to build up your strengths so you're being protected not only for coronavirus, but you may even be protected from all the stress that you undergone in such condition? How to improve your immune system, how to build up your mentality, how to protect yourself from all the stress. Actually, the answer to those old questions can be Kintaro cells.
All right, I think it's time to wrap this up. Thank you especially to Dr. Ihor Miliaiev for wonderfully explaining everything and taking through all the slides, and I did a really good job there. And thank you to everyone that joined. We appreciate you guys being here. So as a follow-up, if there's any questions or if you want to schedule a free consultation with one of our doctors, especially Dr. Ihor, please contact me, travelkintaro@gmail.com. And thanks again for joining us today, and we'll see you all next time. Take care.
Thank you. Bye.